Hello, RDs and RDs to be. Welcome to RD Exam Ready Live. My name is Zach Caseberg. I'm your tutor, your coach, your guide along the path to passing the CDR exam. If you're joining us tonight, it means that you want to learn more about passing this exam tonight, and that's what our session is going to be focused on. I'm a tutor who tends to be very focused on practice questions. Many of you, if you followed me for a while, you know that I'm a huge proponent of practice questions. I want you to be successful on practice questions because I feel it's the best way that it really translates towards exam success. That is going to be our focus for tonight, actually, is we're going to take some time with practice questions. Big thing that we're going to focus on is ensuring we're using strategy. That's really what I focus on when it comes to practice questions is ensure that I'm using a good strategy when I'm applying to them. Because if I use a strategy, it's going to help me to get more questions right on the exam, increasing my score and getting me above that 25 or above that we need to reach there. So, as we're going through tonight, you're going to be picking up some tips that I'll have about using a strategy when it comes to the exam. Now, here's tonight's style. I'm going to be bringing some practice questions up for you that I'm going to put on the screen. I'm going to give you about 30 seconds for you to get started on that question all on your own. Then I'm going to jump in as if we're sitting next to each other on exam day, and I'm going to talk to you about how we should approach this. Then we'll talk about why we got the best answer and give some explanation. The biggest thing to take from it is remember, you're going to get out of the session what you put into it. Put yourself out there, take some risks. What you can do is you can post answers into the chat that you feel is your best answer. I want to be able to see that because if I can provide some correction or some assistance, I want to do that. I'll also be prompting you for questions to help apply your knowledge. And once again, you can use the chat function to go ahead and put that in there or just speak it into the ether. If you don't get a chance to stick with us the whole session, hey, don't worry about it. You might have something better to do. Keep in mind, you can always just come back, watch these live sessions, subscribe to the YouTube channel, watch all the previous lives. If you don't get to watch this one, or if you don't get to stay for the whole thing, stick with it. And also, last point, make sure you check out the mailing list to get some notes following this session. All right, well, we've got a nice little group of RDs to be here, so let's dive into it. Give me just 1 second and I'm going to get my tech worked out and we're going to put up your very first question here. Be right with you. All right, RDs to be getting this thing loaded up for you right here. Just give that just a few seconds for that to work out. Might see that go in and out just a little bit as we go through, but I think we'll have it nice and set. So I have your first question here. You're going to take, again, about 30 seconds to get started on this on your own. Post your answer into the chat if you feel like you have one. And then I'm going to jump in and I'm going to talk to you about what I think is my best answer. Okay. So stick with me through the tech stuff, but we will go into this first question here. 30 seconds. All right, everyone. So you should have had a chance to read through that question, through the answers themselves. You could be starting to think a little bit about what your best answer is going to be or what you're really thinking of here. Let's take a look at these together. A chef is preparing a new chicken entree for the non select menu at the hospital. The new entree will be served on the heart healthy menu for patients. Which of the following dry cooking methods would be best for the menu? So first thing I'm going to do is I'm going to put A, B, C, and D on my board. Remember, I've given you the suggestion to do this because this is that process of elimination that I use to statistically put myself in a better position to get answers right. Okay, that's why I really love this is it just helps me to hopefully get more answers right when it comes to it. Now, as I look at these, I'm going to eliminate bad answers, put a question mark by ones I'm not sure about, and I'm going to put a check mark by my favorite. So as I'm starting with my first one, A, deep frying and roasting. Now I'm looking for the best dry cooking methods that would be best for this menu. Both of these happen to be dry cooking methods. So I'm going to hold on to it for right now and come back to it. B, grilling and deep frying. Okay, also both dry methods. C, sauteing and grilling. Okay, these are both dry methods. And D, grilling and braising. Okay, one of these is a dry method. So, when I'm choosing something for the heart healthy menu, I probably want to choose cooking methods that are also going to be heart healthy. So, starting with A, deep frying. Deep frying and roasting, while both being dry cooking methods, I don't think it's going to be my best fit because deep frying typically is going to add a lot more fat to items more than originally was on there. It's probably not necessary for many menu items and it wouldn't be appropriate for a heart healthy menu. I think we would all agree. So I'm going to rule out answer A first. That's out for me. Same for B, grilling and deep frying. Grilling I feel okay with, but deep frying, once again, it's not going to be a good fit for that. So I'm going to rule out answer B. Answer C, sauteing and grilling. Okay, so sauteing would be cooking it in a pan, grilling would be over a grill, of course. Both of these are dry cooking methods. Both of these seem like they would be okay for a heart healthy diet. I'm going to hold on to this for right now. And D, grilling and braising. So the reason I would rule out answer D is because grilling is a dry cooking method. However, braising is a wet cooking method. And we needed dry cooking methods here. So that would make me rule answer D out based on that. Very good, RDs to be. Excellent work. I love those answers that we saw in the chat. For those of us that got C, we kind of seemed a little bit in line there. If you chose D, one thing I just want you to remember is what braising is, okay? So if you know what braising is, you can drop it into the chat if you want to. But remember, braising is something we'll do for big cuts of meat, like large roasts, for instance, or large hunks of beef are great for braising where I'm going to use a dry cooking method where I'm going to sear. I'm going to take a hot, maybe a cast iron skillet, make it real hot, put a little oil in it, and I'm going to sear that meat so that it gets nice and browned on the outside the way we want it. The other part of braising, though, is you then add liquid to the pan and you place it in the oven. So that is incorporating both dry and wet. But remembering that braising involves that wet cooking method would mean it's not going to be the best dry method. So that would be why we ruled out answer D. Hopefully, you all understand why we ruled out answer A and B, okay, based on that deep frying. On this point, though, is there anyone in the chat who was confused about deep frying? Did anyone think it was a wet cooking method when you initially read it? I'd love to give some clarity on that if anyone was having confusion on that. Because I know it hung me up a little bit when I was studying it for sure. And so I was always like, well, why would, it seems like it makes food so moist a lot of the time. Why is deep frying going to be considered a dry method? Yeah, so the reason it's going to be a dry method is because deep frying is frying the outside of the food. So what it's doing is dehydrating and crisping those things there. And then for answer C, the reason why we kind of have this as the best answer. Sauteing would be in oil. Okay. Now, oil you might think of as a wet method, but what I need you to remember is all of these wet methods include oil. Okay. So when I'm sauteing something, pardon me, back that up. All of these wet methods include water. Okay. So braising includes water or liquid. However, all of these other things we're talking about, they don't involve water. Okay. So sauteing would be sauteing like green beans or that chicken entree in oil, not water. Grilling is self explanatory as to why it would be a dry method in that case, right? So if I said steaming, steaming is a wet method all the way because we're using water and steam to cook those foods, whereas sauteing is just cooking in a pan with oil there. Good. Yeah, definitely not heart healthy. You're right there, Mallory. Yeah. So, Emma, you kind of asked about the different types of wet and dry cooking method. I talked a little bit through that there. Big basics just being wet is going to include water. So, any of those that include water automatically makes it a wet method. If it's just cooking it in oil, roasting it, grilling it, baking it, those don't necessarily include water if you're just cooking something like meat, for example, there. Great job, everyone. Really great. Any other questions about this while we're looking on it? Or if not, you may feel ready to jump on to your next question here, because I am eager to give it to you. Okay, gotta get a new cord. Okay. All right, looking great here, folks. Looking great. Yeah, there we go. All right, so for our second one, let's give you another 30 seconds to start working onto this. All right, I'm going to give this one a read here. A dietitian is implementing the Mini Nutrition Assessment MNA short form in nutrition assessments completed for new long term care patients. The nurse's assessment should include 3 months food intake, mobility, weight loss, psychological stress, mental status, and blank. Okay, so starting with A, B, C, and D. Sometimes for these questions, what I try to do is just kind of generalize myself a little bit there, but it does take some base knowledge of knowing the mini nutrition assessment and what it assesses. For A, weight for age. To me, weight for age feels a little bit off in this context. Normally, weight for age would be specifically being used for like an infant, right? You know, a 1 year old or younger or someone under two, right? Weight for age for someone who is elderly just feels quite off to me. So that's going to be a rule out for me off the bat. B is grip strength. I'm just going to put a little question mark by B. I don't know enough about it to say definitely that I think it's a good answer, but I don't know enough to say that it's not. C, ethnicity. Well, if it's a nutrition assessment, I don't feel like ethnicity is going to be something that's going to really factor in here. I would probably recommend let's rule out ethnicity just because it seems off in this context once again. And D, body mass index, BMI. Okay. This feels like it would be a good assessment, certainly, to look at. We've already looked at in this case the 3 months food intake, the mobility, the weight loss, the psychological stress, and the mental status. We would have to say probably body mass index will be a good fit here, and I'll put a check mark by it. Okay. So between answer B and D, we're at that 50-50 shot if we had to make a guess. But what I always recommend is you go with what your best answer is going to be. And it seemed like a lot of us agreed and thought that D would, in fact, be our best answer for the mini nutrition assessment in this context. So, taking a little look at that, here's what that mini nutrition assessment is going to be looking at in this case. Okay, we're going to be looking at food intake over 3 months, weight loss over 3 months, and then there's different scoring according to different each of these. You don't have to know those specific scores for the exam, but you do need to know this criteria. Mobility, neuropsychological problems, and body mass index or calf circumference. I forgot just one more in here. Let me add that in there while we're looking at it here. The only other one I wanted to add in here was neuropsychological problems. And then actually, let's show you the actual assessment itself. So I'm just zooming into, I'll show you. Here's that mini nutrition assessment that's available through the Nestle Institute. So sourced out to Nestle here. Here's what it's assessing and screening, just pulling that up for you on the screen. So I looked at that food intake that we talked about, the weight loss over those 3 months, the mobility, psychological stress, and then neuropsychological problems, which would include things like dementia, mental status type of stuff in that case. And then the last ones here, it's between F1 and F2, as you see down here. So that's meaning you could choose one of these body mass index, but if BMI wasn't available, you could do calf circumference as another qualifying criteria that you could use. Once again, you won't have to do this full scoring on the exam, but I do think you want to be appropriate or knowledgeable at least with what this is going to be assessing and also the population that it's going to be assessing. So definitely going to be using that for those elderly populations because why would we need to assess neuropsychological problems in normal healthy adults, right? Excuse me. Okay. So pulling that question back up for you to review here, was there any other questions that popped up on this as you were taking a look once it returns to you here? Come on, be cooperative. Sorry about that, folks. There we go. All right. Good. Just looking out for a few more seconds for any questions in the chat there might be. Once again, definitely don't ever be embarrassed to put questions in the chat because chances are if you have that question, there's another student that has the same kind of question going on here. Okay, looking great. Let's pop over to our next question here. Number 3, read carefully. Make sure you eliminate bad answers so you can really focus on what your best options are going to be. All right, it's time to give this question a good read here, folks. A patient is admitted to the hospital after a fall. The patient is diagnosed with severe malnutrition, poor PO intake, and difficulty swallowing. They require continuous tube feedings to meet their needs. After initiating feedings, which lab values would be most important to monitor? So I have A, B, C, or D. So before I even really go into this question, really what I want my brain to be thinking of is what do they want me to look for? What types of labs do I need to be looking for based on what they were telling me? So with that, let's really set the stage here. Tell me, RDs to be, tell me in the chat, what am I concerned about for this patient? What am I concerned about? What should I be thinking of? Is it that their blood sugars are going to go high? Is it that they're going to have dumping syndrome? What am I worried about for this patient based on this context? Help me out just a little bit here. I'm worried about refeeding syndrome. Absolutely. You're totally right there. Because this patient has had poor PO intake, severe malnutrition, and we're starting tube feedings, oh, they're at risk for refeeding. So now I need to remember those labs that are involved with refeeding. Let's see what we can put together. For A, phosphorus, magnesium, and potassium. Yes, these are going to be 3 electrolytes that are certainly going to be very important to monitor in the patient's blood, especially during refeeding. I think that's an answer I'd like to hold on to in this case, but I want to check my other ones out here too. Come on, screen, you can do it. All right, sorry about that, folks. Gonna keep reloading that until that works out. Answer B was gonna be hemoglobin, potassium, and phosphorus. Okay, hemoglobin I'm not concerned about. I think we should rule that answer out in this case. C, sodium, potassium, and glucose. Not ones I need to be concerned with in this case for refeeding syndrome. So I'm gonna rule that one out. I mean, all 3 of them together, that means. And then answer D, sodium, magnesium, and phosphorus. These are not going to be my best ones for refeeding syndrome to monitor. So I would say my best answer for this one, if I'm monitoring for refeeding, would be phosphorus, magnesium, and potassium as our best answers there. Good. For extra credit, everyone in the chat, Can you remind me too, what are these labs going to do when the patient is going in refeeding? They going to stay the same, go up, or go down? What are they going to do? For the rest of us, if you're just learning about refeeding syndrome a little bit, I highlighted here the points that I wanted you to take from that set a perfect stage for refeeding syndrome, okay? Patient has severe malnutrition, poor PO intake, difficulty swallowing. So those pieces, especially the malnutrition and the poor PO intake, have really show they've had a prolonged period of not getting enough nutrients and electrolytes. That's really set the stage for me. So they also have difficulty swallowing, which kind of points to, okay, yeah, probably they're going to have some issues there too. They require continuous tube feeding. So, how this fits into the refeeding picture is that once you start to feed that patient again, they really have not had enough nutrients. And so their body really gets thrown off, very much goes imbalanced. And these different nutrients or these different electrolytes, excuse me, in the blood drop. Okay. So, for refeeding, I'm going to say it right now to be clear. These are what you need to watch for refeeding. Yes, a lot of us are talking in the chat about glucose. Glucose has something to do with it, yes. But if you're talking about refeeding, I want you all to focus on these three things because these are going to be the best indicators for you, especially if a patient is going through refeeding syndrome. And my reason being is glucose can do lots of things when a patient is in the ICU, when the patient is having lots of issues. Glucose can definitely get out of whack, but for different reasons. Like if a patient is on dextrose electrolytes at this same time, is their glucose not going to probably be high? Well, does that indicate refeeding syndrome? I don't know, right? But one thing I could definitely tell is that if I start feedings and this phosphorus, magnesium, and potassium drops, then we're going to show some issues, certainly. Okay. Other thoughts as far as kind of how that factors in with glucose. So let's think of it, right? They haven't had food for a long time. Their glycogen stores have been depleted pretty well, right? So they don't have a lot of glucose, they don't have a lot of glycogen. If you start affecting or if you start really pumping them with nutrients, they're going to get a rise in their glucose shortly after you start the tube feedings, right? Keeping in mind, you're also going to get a rise in insulin, won't you? So if I get a rise in insulin and a rise in glucose, that glucose is going to end up into my cells, right? So maybe you could see different things happen with their glucose when they're going through refeeding. But really, we should emphasize that the electrolytes we're monitoring is this listed in answer A right here. And all those guys are going to drop for sure. Good. Other questions about refeeding while we're taking a look on it? Or do you feel we're in a good spot to move on? Good, good. Refeeding's a really interesting one. A good one to know for sure. What I would really look at, especially, is just knowing that these drop because when you get a question on refeeding, it's going to be directly related to this right here. And all you need to know is these three and that they drop. Let's check out another question here. For number 4, a cook is reheating pulled pork for sandwiches made to order. The pork should be reheated to what temperature? A, B, C, or D? Good. So, starting with answer A, 135 degrees. Now, I know that this can be a good hot holding temperature. That is one good thing about 135 is I can hold foods at a minimum of 135 degrees. However, should that be what I should reheat this pork to? That feels off because, I think of pork about a different temperature. So I would rule answer A out. That doesn't seem like that's the minimum for reheating for me. B, 145 degrees. Okay. So 145 degrees for pork. This would be true for like a pork chop that I was just cooking on the grill and then I wanted to serve. So from raw to cooked, 145 would be acceptable for pork. However, I think there's something to this reheating of the pulled pork here. While 145 might be appropriate for that first cooking method, for reheating it might not be the case. So I'm going to rule out answer B because of that. C, 155 degrees. Okay, maybe we're getting closer here. I'll put a little question mark by C for right now. And then D, 165 degrees. Now, 165 normally I'm reserving for things like poultry, stuffed products, right? Stuffed meats or stuffing made for turkey or something like that. 165 also would be good because 165 would be a good cooking temperature for reheating foods because it would allow me to heat foods up to that 165, killing off the microorganisms that could be present on it up to that temperature. So I would say 165 is a great temperature to pick for reheating those pulled pork sandwiches too. And then I could bring them down to 135 to hot hold them if I needed to. Between this, for this question, I would see my very best answer here is going to be answer D. D is going to be our best fit for here. And I threw this little chart up just to give you a little reminder of the different cooking temperatures. So take a look in the left column for that food there, and on the right is our temperature here. For at the top here, tippy top 165, highest of the high. That's going to be things like your poultry, whether it's whole poultry like a chicken breast, or it's ground poultry. It's all going to be 165. So even if I have the ground turkey that I use for enchiladas tonight, it still needs to be cooked to 165 because it's still turkey. It's still poultry, right? So this would be stuffing as well. So like the breadcrumb stuffing that you see during Thanksgiving. If you made that with like meat, fish, poultry, you would need to make that up to 165. Stuffed meats like a beef Wellington maybe or something like that, right? Maybe beef Wellington's not the best example, but like a stuffed meat or a stuffed bird or a stuffed roast or something like that, we would do to 165. And then the reheated foods. So, foods that have been previously heated, then cooled down to a safe temperature. If you're going to reheat those foods, you need to reheat them to 165. Don't leave them in the danger zone, but you also need to get them all the way up to 165 to kill off that bacteria. Right below 165, or I'm sorry, right below 165 is 155. This would be your ground meats, right? Ground pork, ground beef, ground fish, ground seafood. This would all fit into that 155 right there. And then also shelled eggs hot held for service. Okay. So if I'm holding eggs hot held for service, I'm going to hold them for a while. I need to cook them to a minimum of 155. Let's take one step below that. 145 degrees, my favorite temperature for cooking meats and stuff like that. This would be like whole cuts of seafood. So like a fish fillet, 145. A steak or a pork chop, 145 works totally for those. Shell eggs served immediately. This would also be totally proper to use 145 degrees. And lastly, 135, your minimum cooking temperature. This is going to be for hot holding foods. So, like I said, for this pulled pork sandwich, once I got it up to 165, if I held it at 135, I'd be okay to do that. But also things like green beans, starches, vegetables, carrots, all acceptable to take those up to 135. But lots of people take them higher just because they want them softer. But 135 would be the minimum for safety. Any questions from you, Arties, to be on these cooking temperatures? I know this is a softball question for a lot of you, which is great because we want to have a good foundational knowledge for food safety and understanding these because if they give us those questions, we're going to be more likely to get them right and we're not going to be peppered with more of those food service questions there. Good. Any other questions, concerns with cooking temperatures? You're all pros. Make sure you always use these temperatures at home. It can be helpful for your learning process just to keep them nice and fresh in your mind to pull out that meat thermometer if you have one, check the temperature of foods, make sure you got them to where you wanted them. And you're like, okay, now I remember 165 for reheated foods there. Yeah, question in the chat. Do we need to know the 165 for 15 seconds? Yeah, I would know that probably. Definitely the heat, the temperature itself, you should know because that's what they're going to put in the question, right? It won't be like just the seconds, but I think it'd be good to know the seconds in there. I believe it's 165 for like 17 seconds, I think, or something like that. And then 15 seconds tends to fit for the rest of these. With the exception of like a whole ham, I think they say if you cook like per the USDA, if you take a whole ham and you cook a whole ham, it needs to be 145, but the thermometer needs to stay in there a little longer because it takes so much longer in the center of that piece of meat. So, like, I think for like a hot ham, it's going to be 145 degrees temperature for 3 minutes to ensure it met it, for instance. Definitely the cooking temps, though. We'll have those down. All right, great, everyone. Let's take 30 seconds with this next food science question here. All right, everyone. So hopefully you've gotten a chance to look at these. Not a topic we always study all the time, but it's one that we need to stay nice and fresh as the milk in this question. Milk that has been ultra pasteurized has been heated at blank degrees Fahrenheit for blank time. Okay, very knowledge based type question, right? But I think there's some clinical reasoning that we can also use here. So let's use our A B clinical reasoning, our critical thinking, I mean. A, B, C, and D. All right, so starting out with 145 degrees for 30 minutes. Ultra pasteurized, like ultra, when I hear the word ultra, I think the highest amount, like really the highest amount of pasteurization. There might be one level right above ultra pasteurized, but in terms of ultra pasteurized, I know that I feel like they really do a high temperature when it comes to it. Okay. So when it comes to this, for A, 145 degrees for 30 minutes, I don't know, that kind of feels like it's like what I would cook a steak to, right, for 30 minutes. That doesn't seem like it would ultra pasteurize something. I think it feels like 30 minutes would be a long amount of time for something to be ultra pasteurized. I feel like it's going to be more like a few seconds instead of like 30 minutes. I think I want to rule out A. It just doesn't feel like a good answer to me. B, 280 degrees for 2 seconds. Okay, so that would be well above boiling point of water for a short period of time. This could be a good answer, and I'm going to hold on to it. C, 161 degrees for 15 seconds. That also could be a good answer potentially. It doesn't seem like the time seems to fit okay, but let's hold on to NCD. D is 250 degrees for less than 1 second. Hmm. When I look at answer C, with C, I always kind of think of I'm like, okay, because there's a few different types, right? We're gonna have like ultra pasteurized will be one option. We can have high heat, short time. Good. Like that could be an option. And then we can have like a low heat, short. I feel like I have to rule out answer C. Kind of similar to that of answer A. My feeling is that in order for it to be ultra pasteurized, I feel like the temperature is going to have to be much, much higher to really kill off that much bacteria to because ultra pasteurization really helps with the shelf stability of things. So I don't think C will be a good fit. And if I had to guess between B and D, it would just be a pure guess, probably. But my best answer in this case is going to be answer B as in boy for this here. So if you did not get that answer, remember that's okay. How often are you studying pasteurization of things? Probably not very often, and that's okay. This is just a knowledge based question that we're looking at here. So let's review this chart. Let's make sure we understand this pasteurization a little bit, and then we'll be nice and set for it should we end up seeing it on exam day here. Okay, so on the far left column, you have your processing, your type of pasteurization. Middle column, you have your temperature that it's going to be cooked to, and then the time that it'll be under that. Okay, so let's start with the lowest of the low. This is low temperature, long time, LTLT. Self explanatory here. 145 degrees for 30 minutes. This is very, very common, I believe. I don't know if all of our milk in the stores, that's a good thing to search as we look around. Um, but this seems like a very standard low tech way of pasteurizing things. It takes 30 minutes. It takes a very long time to pasteurize something to really kill off that bacteria. And I would say this would be the lowest of the low. Let me know if you agree or disagree in the chat. Okay. So while I think this would be an acceptable way to pasteurize something, I don't think it's like typically what we see in the store because really if you think about all that milk you see in the store, 30 minutes, that's a long amount of time. Think about all the milk that ends up in the store and if you had to do 30 minutes for each one of those, I don't think that's going to be really going to be a good fit in that case. So the next one is going to be high temperature, short time. What they do is they take it to 161 degrees for 15 seconds. That's going to be what they do in that case there. Okay. So that's kind of the process that they use for pasteurizing for that high temperature, shorter time. Underneath that is high temperature, shorter time in this case, which is 212 degrees for less than 1 second. It's almost like they're blanching it, is what it seems like. So, very little amount of time, very short amount of time. And lastly, here I have the ultra pasteurization. That's going to be 280 degrees for 2 seconds. I believe there might be one more that's above this, but for the purpose of this question, ultra pasteurization is the one that's going to provide the most shelf life. And actually, let me pause that. By this case in shelf life, a lot of the milk that I buy from the store is ultra pasteurized. It's still in the refrigerator but it has a very long shelf life in the sense that if I buy it today, it's probably not going to expire until like the third week of September. Okay. It lasts almost like a month, which is a long time for milk. And that's because it is ultra pasteurized. So, ultra pasteurized milk, you can't just put it on a shelf and store it on a shelf. You still put it in the refrigerator, but it dramatically increases the shelf life of your products, of your milk when you're using it in that case. Okay. Again, not something you need to study every single week, just something to get some good base, throw it on a nice note card, come back to it every few moments a little bit, just so you have these down in case a question was to pop up about something like ultra pasteurization in that case. Yeah, Rachel, so you asked about is so ultra pasteurized always going to be the highest temperature? I believe so. There's one right above this. There's one right above this, and this is for milk that is shelf stable. Okay. So by shelf stable in this case, I mean milk that I can put literally ambient temperature on a shelf, literally, and it'll sit there. Like when I've been traveling before, I've gotten like milk that's shelf stable, meaning they store it on a shelf. And then when I open it, I just have to put it in the fridge. So ultra pasteurization, yes, is going to be that 280 for 2 seconds. The only one above this is going to be ultra high temperature, okay? As if there's not enough, right? So ultra high temp is milk that I can put on shelves, literally. I can put it on a shelf and I just have to put it in the fridge once it's open. So let's say shelf milk. This one they heat between 280 to 300 degrees is what they'll do, and they do it for like 1 to 2 seconds. So I guess with that additional 20 degrees they might use, it's literally making it so the milk can be put on a shelf, assuming it's being put into a clean container, would be the big key point there, I bet. Very good. So much about milk, right? Okay. Looking great. All right. So hopefully we'll get through most of these questions here. I've got some other knowledge based ones for you to apply your knowledge. So let's do this here. Take your 30 seconds and maybe use this as a clue about how is my knowledge sitting on things like food science of these little topics. Make a little note for yourself too. For number six, the FDA requirement on food products that specifies the ingredients with proportions and composition of food is known as the what? A. Standard of identity. B. Standard of fill. C. Standard of minimum quality. Or D. Standard of appearance. Okay. So, how well have you understood these terms when you've seen them in questions, right? These are those standard identities that we have to have set for foods. And it's something that the FDA has said to make sure that foods are how we identify them, right? They have to make sure they are how they're being identified in foods, right? So, that being said, as we kind of look at these here, standard of identity. Okay, so standard of identity would kind of imply something along the lines that we're thinking of, all right, the food is what we're saying it is. When I look at the question, it says specifies ingredients with proportions and composition of food. I think answer A could be a good fit, but I want to read through the other answers here as well. For B, standard of fill. What is standard of fill for things as it looks at? So, standard of fill kind of serves to be almost like if I say that sunscreen is 4 ounces, then it's actually 4 ounces. Okay. So, that would be kind of like a standard of fill that things are being filled to what we tell them. Otherwise, it's a little bit misleading to consumers. I actually don't think it's going to be answer B because standard of fill is kind of saying like how much you fill the product itself. So I don't think this is a good fit here because standard of fill is going to be more related to how much is in it, whereas the standard identity or another answer might be more specific to the composition, the ingredients, things like that. C, standard of minimum quality. Okay. I don't think this would fit well with proportions and composition, but I can hold on to it. And D, standard of appearance. I've never heard of standard of appearance. Because I don't know about it, I wouldn't choose it as a good answer because I don't want to just pick something because it's there. I want to make sure I have good root knowledge that tells me why it's a good answer. For this answer D, I don't have that. So I would rule this out based on that. So for A, standard of identity, or C, standard of minimum quality, 50-50 shot, but you go with your best answer. And in this case, I would say standard of identity is going to be our very best answer for this one here. So this is good stuff to know, right? It's good to know standard of identity. And it's exactly what we're stating here. So the FDA standard of identity is saying, hey, what are the ingredients that are in the product? Are they accurate? And then it also is specific to the proportions, right? So when you're listing ingredients in order from highest amount of weight to the lowest amount of weight, that's technically adhering to those standards of identity in that case. Very good. Very good. So making sure that there's the ingredients in the foods that they say are in it. As I said, standards of fill would indicate that if something is 3 ounces, that it is in fact going to be 3 ounces, that you're not lying to people or lying to consumers about how much is in a product. Standard of minimum quality would indicate the minimum quality that's acceptable for a product. Meeting things probably like safety standards, for instance, would be an important thing to consider here. It's not going to kill someone if they put a cosmetic on their face, for instance. And then for answer D in this case, D is just a throwaway answer. There's no such thing as standard of appearance. But what I want to applaud you all on is not jumping on that answer, because a lot of the times on the test, we like doubt ourselves, right? We say, oh, well, you must not know what the answer is. So that must be the answer because you don't know it. But that there's no like root knowledge that you're falling back to say why that's your best answer. So why would you choose it as your best answer just because you're doubting if you know this topic? That's not helpful at all. Use the knowledge that you do have to help you with eliminating other answers to come up with your best answer in that case. It's the best thing you can do for yourself. Good. Going to give it a couple seconds for questions if there is any on this, or we're just going to go into our next last few questions. Okay. Very good. Let's take a look at number 7 and see what you know about community needs assessments. All right, folks, hopefully you've had a chance to start getting through that read. A dietitian is conducting a community needs assessment. They've collected assessment data on their community. The dietitian should next do what? For A, share findings. B, set parameters of the assessment. C, analyze findings. Or D, develop a data collection plan. Okay, so when we think about the steps of the community needs assessments, what I really recommend to students is critically think about the orientation of these steps and how they should go through. That seems to be what a lot of you are doing here too. For A, share findings. Okay, so I've collected the data, share findings. Okay, I would think shared findings would fall some part after collecting the data. That fits to me. So at least I know sharing findings would fit after collecting data in some way because I'm sharing what I've collected. I don't know if it happens directly next. And that's the big key to this question. What happens next? Okay. Not what happens in 2 steps, 3 steps. What happens the next step? That's helpful. I'm just going to hold on to A, but I want to check out these other answers. B, set parameters of the assessment. I don't know, Arties to be. Maybe tell me why bad? Why is B a bad answer, and why did many of you rule it out? I'd love to hear, for those of you that did rule it out, of why you think it's a bad answer. Help me out to rule it out if you think it's a bad fit. Is it because you think it happens last in the assessment, or because it happens first in the assessment? What do you think? For C, analyze findings. So I've collected that data, analyzing findings. Yeah, that does seem like a good step for us to do, right? Is to say, all right, we need to analyze the data that we've just collected. That way we can then make some inferences based on that, right? C feels like a good answer. I'm just going to throw a little check mark by that for now because I really like it. And D, develop a data collection plan. Well, develop a data collection plan. If I already collected the data, why am I developing a plan? That doesn't make much sense. I'm going to really answer D out based on that. So, with B, as I come back to this now, many of you have told me this has already happened, right? This is actually kind of the first step of the planning and needs assessment is setting parameters of the assessment. It's like a pre-step basically. So that'd be a good reason to rule this out is because we've already done this at this point. Okay, cool. So now I'm literally 50-50. A, share findings or C, analyze findings. I need to analyze, or excuse me, I need to say what happens next. So while sharing findings will happen later, I don't think I do need to do it next. I think I need to analyze those findings and then I can share them. I would say C is going to be my best answer for this one here. I outlined here in this yellow box your needs assessment steps. Make sure you understand these pretty well and that you can kind of write them out for yourself. If you're feeling overwhelmed by the number of steps, what I'd recommend is don't be. Don't feel like you have to always know what is step two. A question is not going to ask you, it's not going to say, well, what is the third step of the community needs assessment? That is not going to happen. And if they did that, that'd be very unfair to you. A lot of the questions are going to be kind of specific to what I've just done here. What is going to be our first step? What is going to be our last step? What is going to be our next step? These are the types of questions they're going to ask you. That's very helpful because you can now use critically thinking to orient these things correctly in your mind. For instance, setting parameters of the assessment, answer B, well, that's something we do at the first stage of the needs assessment. This told us that, hey, this happened in the beginning. If we're collecting data, we're way past this point of setting parameters of the assessment. That's why I ruled it out. Same kind of goes for sharing findings. I know that this is going to happen way later down in the steps, not necessarily right now. That's why I ruled it out. So for these needs assessments, let's just talk these out really quick. First would be the set parameters of the assessment. What am I looking for? What am I trying to investigate? Who am I trying to investigate? Where am I trying to investigate? Develop a data collection plan. Are we going to be doing surveys? Are we going to be going to door? Are we going to be measuring, I don't know, compliance? Are we going to see how many people attend community programs? What are we going to look at? Collect your data, actually do the surveys, collect the data on the community, analyze the data. Let's say that you're collecting data on heart disease, right? Well, you're going to analyze the data, probably put it into a software to understand what the highest amount of risk factors might be that you identified from your survey, perhaps, or what comorbidities are the highest in your community. That's what you're analyzing. Then you're going to share your findings, set priorities, and then choose an action plan, which then takes you into the following steps of actually developing and implementing a community nutrition program. But before you ever develop a community nutrition program, you of course first have to do a proper community needs assessment. And that's your steps right here to doing so. A lot can go into this community part. Um, for those that don't know, not to like worry anyone, the exam in the new year is going to take a shift towards much more heavier community questions. So it's really good we're doing community. We're going to see more community coming up. So we need to stay nice and fresh on these processes because it's going to help us to answer better questions there. Very good. If there aren't any questions on this one, 27 great artists to be here. We're going to move on to our last few questions of the night. Let's do number 8 here. Apply your knowledge for medications and tell me which ones we need to avoid here. And maybe why for extra credit. Very good. For number 8, a patient is meeting an outpatient dietitian. The patient's chart reveals that the patient is taking monoamine oxidase inhibitors, MAOIs, daily. The dietitian should recommend the patient to avoid which foods? A. High sodium foods. B. Organ meats. C, ocean fish, beer, and vegetables, or D, hard cheese, sausage, miso, and yogurt? Would be our best fit when it comes to here. Okay, so MAOIs, monoamine oxidase inhibitors. I do remember we've talked through there are certain medications that these patients need to watch out for, okay? So let's see if we can identify which ones we're going to do that with. A, B, C, and D. Okay, so for A, high sodium foods in this case, the high sodium foods kind of feels like one that wouldn't fit too well with MAOIs. I may think of high sodium foods with like lithium. Lithium might make me think of high sodium foods or maintaining normal lithium levels, but lithium is not going to be an MAOI, so I would rule out answer A. High sodium just does not feel like a good fit in this case. B, organ meats, seafood, and beer. Okay. Which condition have I thought of this before? Okay, I'm going to put a little question mark by that. We'll come back to it. C, ocean fish, beer, and vegetables. Okay, question mark there. And D, hard cheese, sausage, miso, and yogurt. What do these foods all share similarities with? They all are fermented and aged, a lot of them too, especially like miso, yogurt, fermented, kefir, things like that. Those would all be fermented foods. And we do have to watch out for foods that have a lot of tyramine, okay? Especially the MAOIs, tyramine specifically is going to be found in many of those fermented foods. And this is what they have to watch out for when they're taking MAOIs. Based on that, for hard cheese, sausage, miso, and yogurt, I know these are all going to be high tyramine fermented foods. I would say that's going to be a good fit. When I look at B and C, beer has some fermentation, certainly for each of those. The organ meats, I don't know. But I would say I need to go with my best answer, which in this case I would say would be answer D. With MAOIs, you gotta watch out for those high tyramine foods. And yes, those are gonna be those fermented foods. Hard cheeses, sausage, miso, yogurt, smoked, fermented types of things here, which all of these fit really well into. So these would be the ones you would have to avoid with MAOIs. For A, I was thinking of maybe like lithium. As I said, lithium might be a good thing to avoid that high sodium foods, but that's not a concern for MAOIs here. For organ meats, seafood, and beer, did anyone think of any other conditions that might have to watch out for these foods? Any other conditions or medications where we might have to avoid these types of foods for answer B? Anything that came to your mind? It's kind of like there's one or two conditions that kind of fit with these types of foods, like this beer, fermented, all this stuff here. Yeah, Laura, very good. So gout, for instance, B really makes me think of gout. So these are the types of foods you have to avoid with gout. In that case, those purine-rich foods. C for ocean fish, beer, and vegetables. This just isn't a good fit. The beer's a maybe, right? But the rest of these probably aren't necessarily a good fit necessarily. And D, hard cheese, sausage, miso, yogurt, as I said, are high tyramine foods, and with MAOIs, we must watch out for our intake of those. Good. All right, everyone. We're at the top of the hour, but we just have two more questions to go through to end our night. So if you feel like sticking through, let's stick around and let's finish these last two questions. The last of which is going to be an enteral nutrition one. So if you do need practice on that, stick around for that last question or just come watch tomorrow after you get some rest. Let's get number 9 and let's practice a little bit of our leadership styles. Recently talked about this on a podcast. Hopefully, you got to listen to that RD Exam Ready podcast episode. You listen back. You got a little review on your leadership types. If you haven't, make sure you go listen into that. Spotify, iTunes, YouTube, wherever you like to listen to stuff. Go check it out. So, if we have a leader who is indifferent to the results of the company, but is constantly accommodating to their staff members, fits with which of Blake and Moulton's leadership styles here? Well, I can tell you all listened in because you're really good on your answers. For A, B, C, and D. Okay. So let's set up a little chart here. Let's do results and people. Okay. Make sure we understand that. So for an impoverished manager, I always think of this the lowest of the low. I think of poverty is what I usually think of in this case. And so for an impoverished manager, what I would really consider for this one is they're going to have low concern for the results, but they're also going to have low concern for people. Okay. So this would be low and low in this case. So low concern for results, low concern for people is what impoverished is going to be. Country club manager, they're going to be very low interest in the results. They don't care about results much, but they want everyone to have a good time. So they do like people. We can give them that. They are good with people. For C, middle of the road manager, that's going to be middle of the road on the results, middle of the road on people. Okay. Very much concerned on status quo. And D is going to be the team management style, which is going to be high concern for results and high concern for people. In this question, what it led us to is indifferent to the results, but constantly accommodating to their staff members. That tells me that this person doesn't care about results, but really does enjoy people and wants to be liked. And it's based on that I would say B would be our best fit here. Because for A, impoverished, that wouldn't be a good fit because they really don't care about anything. So that would have to be out. Middle of the road is not really overly caring about staff and not overly caring about results. So I would really enter C out based on that. And D is team management, which would be the highest of the high, ideal situation usually. B, I would have to say, is our best fit for that country club manager. Good. So, since many of you had listened to that probably on the podcast recently, you may have had questions. If you do have questions about it, please drop it into the chat now. Or if you feel like you're just having confusion or need some tricks to go through these, ask about it in the chat. I'm happy to talk through that with you. Yeah, Laura. I'm glad that it helps you with the numbers there too. I will give you the numbers for each of these, Laura. I don't have like all of the numbers for each of them in my head. I think I can mostly get ourselves there though. Um, so Laura, let's pretend under this case that it's going to be, let's say, results, comma. That'll be our first number, and then people as the second number. Okay. So for an impoverished, that'd be like a 1, 1, for instance. Okay. So meaning 1 is like the lowest level they could have interest in the results, 1 being the lowest level they have interest in people. Okay. For those of you that are confused there. Country club manager would be a 1. I think it goes up to 9. Let's pretend it goes up to 9 is the highest. So 1, 9 would be 1, very low interest in results, 9, very high interest in people and keeping them happy. Middle of the road, you're correct there, Laura. That'd be a 5, 5. And then the team manager would be a 9, 9. Okay, so they're very highly caring about results, but they also very highly care about people. So that would be the numbers that fit with this one here for anyone that needed that number grid a little bit too. I was never like numbers for this. And I think it's good if you are numbers. It shows you fully understood it. But I just came up with different people in my head that I thought fit with each of these categories. And a lot of times when I would see these leadership styles, I would think of that person visually. I'd be like, that's that person I think of that fit really well with the country club manager or parental. Oh gosh, I'll say parental or parents that paternalistic type of management style. I would think of a certain person for that, but that's just what was helpful to me. Yep, very good. All right, everyone, get those calculators out because I got one more for you here to finish your night. Really to work your brain before you all go rest, hopefully, or have dinner, or your next steps in the night. So take your time. I'm going to give you about 45 seconds to start working on this. Then I'm going to jump in with you all. For anyone that's having difficulty with Enterol, if you want to hold off until we start together, and then we'll go through it as a group to finish our night. All right. So I see some people getting kind of started here. It's okay if you're still holding off, it's totally fine. Take this slow. Make sure you feel confident in your process. All right. Patient is receiving a 1.2 kcal per milliliter tube feeding formula at a continuous rate. Good for them. Their tube feeding runs at a rate of 56 mils per hour between the hours of noon to midnight, 12 hours there. How many total kcals will the patient receive per day? Okay, so let's go ahead and let's start at their. I always say, what do I need to find first? I know I'm a broken record, everyone, but I need to find that total volume. Okay, I want that total volume. That's how I like to operate. I like to know how much volume because it helps me to then say, hey, how much free water they're getting, how much protein they're getting, how much kcals they're getting. It helps me to be very flexible. So with their total volume, I'm going to set up my formula here. I have 56 milliliters for every 1 hour. They are getting their tube feeding for 12 hours. Okay, so I'm going to write 12 hours over here, over 1. The hours cross each other out because if I have hours on top, hours on bottom, there's no hours left. They cancel each other out. So then, sorry everyone, I wasn't prepared with my calculator, you see. Don't be like me. I'm going to take my 56 times the 12 hours, and it's going to tell me what their total volume is going to be. And that's 672 milliliters. Checking my work once more. Good. So that's the total volume of the tube feeding they're getting in a day. Not the water, just the total volume of the tube feeding that's in the bottle. Now, I can go anywhere from this fluid, I can go to protein, to kcals, but in this case, the question wants me to look at kcals. So I'm going to take 672 kcals and I'm going to set up that formula just the same way I did. I'm going to, instead of doing it, oh, no, definitely I'm going to do that. So I'm going to start out and I'm going to do 672 kcals. Whoops, you all need to correct me when I do that. 672 milliliters, and I'm going to multiply that by the kcals per milliliter, okay? So I'm going to have 1.2 kcals, 1 milliliter, milliliters on top, milliliters on bottom, means that they cancel each other out, leaving me with, at the end of this session, 672 times 1.2 gets me 800 in about 4.6, but we'll just say 805 kcals in total for that patient's tube feeding there. Okay. Seems like that's the answer that we all got to. Not a very complex tube feeding question, I would say, but what I wanted to do was really emphasize and make sure you understood well enough about if they don't give us 24 hours, what do? We need to use that 12 hours in that case to come up with our best answer. If it was 8 hours, I would do it times 8. If it was going to be 24 hours, I would do it times 24 in that case. All right, everyone. So, once again, I want to thank you all for watching, listening, and learning with me tonight. I very much enjoy helping all of you onto your next steps for the exam. If you're taking the exam soon, best of luck to you. Pretend like I'm there supporting you through the whole session. For those of you still working on it, always feel free to come to these sessions, listen to the podcast. Follow me on social media. Reach out to me with questions if you should have any. Um, yeah, and then thank you for always supporting. It always really means a lot to me and for being here. If you want any suggestions, feel free to follow up with me. Great work on your questions tonight. It was a pleasure getting to teach all of you, and I guess I'll just sign off and say happy studying to you, RD to be. I'll talk to you really soon. Bye now.